welcome Dr. Divya from Vision Tree, Vishakhapatnam.
Good evening, everyone. Scope of the presentation includes a background. Why do we need to do a scraping? The preparation before the procedure itself, and points to remember. So, procuring the samples from the infiltrate greater than 2 mm is called as corneal scraping. Erasmus Darwin, who is the grandfather of Charles Darwin, was the first person to suggest the idea of therapeutic debridement to make the cornea clear. Then why do we need to do a corneal scraping? There are many kinds of pathogens that cause corneal infections. So the clinical manifestations are complex and diverse. So early rapid effective diagnosis is needed. So that for that we do a scraping, and apart from that diagnosis, it decreases the organism load and also help in better penetration of the drug. So before going to the procedure, it is always better to document the case in the form of slit lamp images and also drawings to know the progression or healing of the ulcer. And we should also counsel the patient regarding the need for the procedure and the steps, so that it avoids unnecessary anxiety, and we should be ready with all the instruments required for the procedure. So we need paracrine, Kimura spatula 15 number blade, and eye speculum optional, slides, cover slip, 10% KOH, gram stains and culture media. So this is a video showing the procedure. We'll first instill the paracrine drops, which is least bacteriostatic compared to others. Then we scrape with the sharp edge, we scrape the infiltrate from the margins and the center. Then for the gram stain, we smear the material and label the smeared area with a marker under surface, and also write the patient details and the stain which to be done on the slide itself. And for KOH, instead of smearing, we'll just tap the material and add KOH. And place the cover slip. Then we examine the slides to find the organisms under the microscope. This is the SDA agar, where the material is inoculated, taking care that it doesn't touches the walls, and in blood agar, multiple C shapes are inoculated. So on KOH, first we examine under 10x and then 40x. So these are different organisms like fungal elements. You can see Acanthamoeba double wall cyst, and though it is difficult, we can even say a Pythium, which is much broader compared to fungi with lesser septae. In gram stain, after following a proper protocol in staining, we can see gram positive and gram negative bacteria. Along with that, you can observe Acanthamoeba cyst, Microsporidia. These appear as a safety pin appearance, and due to the presence of polar bodies, and also Nocadia, they appear as a beaded filaments. In cultures, we can see bacterial and fungal growth, and in SDA, this is the fungal growth. We can go with an optional medium if you suspect other organisms, like McConkey if you suspect an enteric organisms, Lowenstein-Jensen for mycobacterial, and NNN medium with E. coli if you suspect an Acanthamoeba, and atypical stains like acid fast and also chalcofluoride gympsa for fungi. So this is a slide showing therapeutic debridement. So corneal scraping, apart from the diagnostic, it can be used for therapeutic purpose to decrease the load of organism and also for better penetration. So points to remember: for a beginners, you can start with an upward stroke for better collection of the material. And if less material is available, go for grams and chocolate agar. And in advanced keratitis, because of the keratolysis and desmetocele, be careful not to perforate, and be ready with the glue, and you may not get any organisms. So in contact lens keratitis, send the contact lens for culture, and also the solution and the lens case to find the organisms and also the source of infection. And if the keratitis is present with an intact epithelium, first scrape the epithelium and then remove the infiltrate. And for deep stromal keratitis, go for other methods like biopsy, passing a suture, lamellar, flap biopsy. And if the culture is negative, stop the medications for 24 hours and then repeat the scraping. Thank you.
Thank you, Dr. Divya. So this was a very crisp summary of how, from the ophthalmologist point of view, what we should take care. Any questions to Dr. Divya?
Any questions from the audience? Thank you, Dr. Divya. Nice videos, and I would appreciate that. One point, you said speculum optional. So I would rather disagree with that. Speculum should be used almost always, because patients have a tendency to squeeze the moment you go in with your instrument. So it's always better to put a speculum. And
Actually, we use the non-dominant hand to separate the lids, because we have observed in few patients that they're feeling really uncomfortable after keeping a speculum. So they're becoming more anxious.
yeah, that's true. So that's why I said ki as far as possible, you should
Okay.
you should try to put a speculum. And so any other device with which somebody can do this corneal scraping, because at times they may not have this BD handle with 15-degree blade. So any other device with which corneal scraping can be done, which is
15
readily
number
available?
blade.
Okay, so 15
Number
number
blade,
blade can
yeah,
be used.
used.
Also at RP center we use 26 gauge needle.
Yeah.
That also can be used. That is quite easily available. These are disposable needles. You can keep in your slit lamp and you can use that. And one important point is, as ma'am also highlighted, please clear all the mucus, everything from the ulcer bed before going for scraping. And could you just tell them why is it important to scrape from the edge as well as base?
So the advancing age has the actually has the organisms multiplying, so you don't get a debris or necrotic material if you scrape from the advancing age, like edges.
And also some organisms, like why do scrape from the base? Then some organisms like Moraxilla, they are found in base only. So if you just scrape off the edge and leave the base, then you may miss such organism. And second, as you have seen that video, please don't do like this to and fro. It has to be unidirectional. Okay.
Sorry, actually, I have mentioned at the last slide, that's point to remember.
Yeah.
In order to show that for beginners, you can try in the upward direction. So I added even that also. Actually,
Yeah.
I want to tell that that's actually wrong way to do in both directions. So only in one direction we have to.
Yes, it's always unidirectional,
Yeah.
and for students, if you are sitting here, examiner will ask you, the standard answer should be, it should be repeated, unidirectional from the edge as well as base. That is the ideal description how to do scraping. Thank you.